Okay. Good afternoon, everybody. I want to thank you all for being here again, continuing to cover us as we go through this crisis together and give daily updates. Today, certainly we'll hear from Dr. Gupta as well, but I wanted to really take this opportunity to talk about a partnership that we have with the county. Throughout this process, everybody in every way has had to adapt to change with what is our new reality for the time period. And the private sector has been innovative, and the private sector has been impacted greatly by what has happened with COVID-19. And one of our great local companies reached out to us, Tessie Plastics, and they thought they could partner and fill a gap. Yesterday we talked a lot about PPE. We talked about that's emergency protective gear for our first responders, for our healthcare workers. And we're very happy to have Tessie Plastics with us today to announce that they will be manufacturing face masks, plastic face masks for different hospitals and counties alike. So at this time, I want to bring up Judd Van, who's going to show you what these masks look like and talk a little bit about them. Judd, come on up.
Good afternoon, everyone. I'm Judd Van. I'm responsible for sales and marketing at Tessie Plastics. What we can say is we're really excited to be working with the County Executive's Office. This is a three-piece assembly that Tessie has designed and developed in the last few days. It's comprised of a headband, a visor, and a face shield. The County Executive's Office has kicked off a purchase order through Tessie, and we'll be making about 30,000 units of this to start. We should start production at the earliest Friday of this week, and we'll get this into the hands of all the healthcare professionals around Central New York that are supporting all of those in need. Thank you very much.
Thanks, Judd. We appreciate that. This is going to be an ongoing issue, and to be able to work with a world-class company like Tessie to make products that we need immediately is really important. So I want to thank Judd, I want to thank the Beck family, and certainly our Tessie family overall for their partnership, and we're happy to be their first order, and it's PPE that is sorely needed. Saying that, let's get into some numbers, and then we can highlight some various points, and then we'll have Dr. Gupta say a few words. We are currently at 249 positive cases. That's up from 228 yesterday. 21 more cases in total. 31 individuals are now in the hospital. 12 are critical. These are sobering statistics. This virus is tough. And as we have more cases, during parts of these cases, the symptoms may be varying, but they can get severe, and that's what leads to hospitalizations. So that's why when we say the things we say, we are trying to change behavior to avoid these scenarios. Certainly, each one of these patients in our 12 critical condition are in the ICU. They're in it for a fight. So we need to think about them, we need to pray for them and their families that they get through this fight. These are our neighbors. So please continue to think about them. One person has been released from the hospital. That's up from 10 yesterday. This is a good sign. People are going to come into the hospital, they're going to get better, they're going to go home. So that's good. Today, there are 55 people who have recovered and have been released from mandatory isolation and quarantine. So that is up from, it was at 41 yesterday. So the status check for today, in total, we have 249 positive cases, and we are presently monitoring 194 active cases. So that's 194 individuals that the health department is still working with in monitoring their symptoms, as is their primary care providers. Again, we are always going to report to you the positives. There will be a curve with the positives, and we want that curve to flatten out. There is also going to be recoveries, and then we will be monitoring the active cases. And again, there will be a curve with active cases. Now we have recoveries. Hopefully that curve starts to flatten out as well. 22 of the hospitalized, every decade is represented except for those under 19 and under. 22 individuals in our positive case are household contacts of previously confirmed cases. So we have 227 cases, 22 contacts are affiliated with those 227. That's where we get our 249 number. I know I've had people email me about that. These contact cases are typically from people in the household. You can understand if a spouse or a significant other is going to get it. People in close proximity to that may test positive. These are positive tests. To break down these numbers, we have 140 female positives, 109 males. 7 are under 19 years of age. 53 are in their 20s. 36 are in their 30s. 39 are in their 40s. 46 are in their 50s. 39 are in their 60s. 19 are in their 70s. 9 are in their 80s. And 1 is in their 90s. Overall, 24% of our cases are under 30 years of age. 39% are under 40 years of age. 54% are under 50. 73% are under 60. 27% of our cases are over 60 years of age. Breakdown of municipalities. 78, City of Syracuse. 29, Clay. 18, Camillus. 18, Cicero. 17, Salina. 16, DeWitt. 14, Onondaga. 13, Pompey. Manlius, 12. Geddes, 9. Lysander, 7. Skaneateles, 4. Lafayette, 3. Atisco, 3. Van Buren, 3. Tully, 2. Fabius, 1. Marcellus, 1. And Spafford, 1. This disease is in every corner of our county. It's in every municipality. With the exception of one town, Elbridge, one of our smaller towns, there are no positive cases to report on at this point. Related to testing, again, testing in our community is ongoing. If you have a situation where you are symptomatic, you are sick, you have COVID-19 or flu-like symptoms, please contact your doctor. If you don't have a doctor, please contact the Upstate University triage line so that you can be screened, and if they believe you meet the criteria, you will go get a test. There are tests here for you. We've been testing because we want to identify positives. We want to then quarantine. And then through social distancing, we then want to flatten our curve. We have over 3,400 tests back. The number is 3,407 total tests, 249 positives. That means we have 3,158 negative tests. We got back 192 tests since we talked yesterday. And we have 485 pending tests right now in the community. To remind people, between 15 and 20% of the pending tests are probably counties surrounding Onondaga County. So we have, probably between 400 and 430 tests we're waiting for in Onondaga County. 7.3% of those that have been tested have tested positive. That number has gone up. What we've seen over the last week or so, the percentages of tests that are done are now a higher percentage. Initially, there was a very large surge of testing. That demand has fallen off. As that demand has fallen off, we've seen higher percentages of those being testing positive. After a positive test, our health department will contact you to check on your health and gather information about any direct contacts you have had since the onset of symptoms. Again, everything we do is based off of when you got sick and when you started to have symptoms. Your primary physician will also contact you as well. This is how our health department knows when to start the investigation as far as quarantines go, based on your direct exposure with other individuals. Direct exposure is not passing an individual in the grocery store, or that fact sharing a same employer. Direct exposure is having direct exposure to another individual when they are symptomatic. Again, a reminder, our health department is busier. When they're contacting positive cases on a daily basis, if one day you're in good health, maybe the next day, depending on flow, you may not hear, but then you'll hear the next day. Again, on quarantines, again, you need to be ready. When you get the call, please answer the call or call us back. As a reminder, anyone who has been tested must stay in quarantine until you get your results. The turn times are on average, again, this is on average, 24 to 48 hours. That doesn't mean you won't get it back faster, and that doesn't mean it might come back a day later. We're talking about averages throughout this process. And again, this is common sense, but sometimes people don't exercise common sense. If you're sick and you're still an essential employee, you need to stay home. If you're sick, don't go to the grocery store or the drugstore. If you need help picking up a prescription or whatnot, we have lines that can help you. Call a family member that might be running an errand, and they can drop it off at your house for you. This is common sense. If you're sick, stay home, right? Certain tips. We're getting continuous calls and media inquiries about tips that they have about positive cases and their contacts. As a reminder, the health department does a thorough investigation on each case. Direct contact exposure begins at the point when symptoms begin and are reported by the individual, not when they were tested. Certainly, this is something that there's anxiety, right? Everybody is now hearing about people in quarantine. They're hearing about individuals who work here or there. It's important to note, in our investigation, we figure out when they got sick, if they came into work, when was the last time you were at work. We go through the supervisors, we go through the schedules, we contact those people, who's at home, who did you socialize with. This is all done. And if you had somebody that you worked with and you don't get a call, it's because you did not have direct exposure. If you believe that that's not accurate, you can always reach out to the health department. At this time, I want Dr. Gupta to come up again and talk to us about release from home isolation and quarantine. Doctor?
Go.
Thank you. Good afternoon. So I'm just going to go over again the criteria for isolation and quarantine and make sure we are all on the same page. It may seem repetitive, but at the same time, I think it's very important for everyone to understand what the isolation means, what the quarantine means, and when we are trying to get people off that, releasing from either isolation or quarantine, we follow very specific guidelines based on Center for Disease Control and New York State Department of Health. So first, isolation. Isolation is defined as when we put a case which has symptoms and who is tested COVID positive. That person is going to be put on isolation, and we follow that patient for a certain time for their fever, for their improvement in symptoms, and also to see that how many days have passed. So at the recent guidelines, what we have to have a 7 days since the first symptoms. Symptoms could be fever, cough, shortness of breath, sore throat, headache, nausea, vomiting, diarrhea, or feeling body ache, anything which may make them feel sick and they had to seek medical attention. So 7 days has to pass since that, and the 3 days out of that should be without any fever, without taking any medication to reduce fever, like what we call officially antipyretic medication, like Tylenol or ibuprofen. And third item is that the symptoms have to show improvement. They may not be completely gone, which is okay, but as long as they are on the right track, that's what we want. Hopefully they will be completely resolved, but a lot of times you are pretty much a tail end of it, so we want to make sure people can do what they can do in their daily lives. Sometimes, depending on, these are the guidelines, some people will actually get off maybe in 10 days, depending on how their symptoms are extending. So it's very important for us to remember, you can't expect that it will be 7 days for everybody, but it will not be less than that. The other category is that asymptomatic people. As we have noted, that people are going and getting tested. They didn't have any symptoms. They had somebody they knew. They felt very compelled to get this test. We do have availability of tests in this community. So they got tested, and now we just feel like, what do we do with this test? Because this person doesn't have any symptom. So that criteria is that's the time which we take. The date of test is the 7 days. So we have to take some criteria, and that's what we do. The other area is the quarantine. The quarantine is those individuals who are either household contact of the case, the person who has been COVID test positive, or the friends or family who they have interacted with, or they had like a get-together in last whatever few days. Usually we like to see from the onset. So the day of onset, this case might have exposed those contacts. That's how their clocks start to click. And then we have to make sure we contact them. We all, whether it's a case or contact, we also ask them their past medical history, because people who have underlying medical problems like asthma, COPD, heart disease, diabetes, cancer, obesity, a lot of those things are any immunosuppressive condition that we will take into consideration, because in those situations, what happens, you can have a persistent fever. We have to think, do you have continuation of this problem, or do you have a flu now, or do you have worsening of symptoms of your underlying disease? For example, those people who have lupus, or those who can have resurgence of their underlying problem. So that becomes very complex. So these are guidelines again. So 14 days is from there for the quarantine, from the day of exposure, from the last exposure of the contact of the case. So if I was in contact with somebody who was COVID positive, and the day I had interaction with that, my friend or family, that day will be considered the day 1. And then we go 14 days. As long as I'm feeling fine, I have no fever, no other new symptoms, or everything continued to improve, or if there was any, then we can go up to 14 days. However, if in between their symptoms arise, it means that we can consider this is a presumed case now, because we have epi-link, what we call epidemiological link. It means by the association with the case, whether we test it or not test, we are going to presume this is a case, and we are going to continue to monitor for whatever comes last, whether it's 7 days or 14 days. That's how we stretch it, because we want to make sure that people in the community are safe in terms of they should feel comfortable that somebody who are they walking around is not spreading the infection. Based on this guidelines, that's what we can feel comfortable at this point. However, I always say however, there is no perfect situation. We still have so much unknowns about this that we would like people to continue to really follow principles of social distancing and make sure you are not doing social congregations and big get-together, and whatever you want to do in your house, it has to be very limited, and 6 feet and social distancing should continue. Few other points which I would like to say is also, depending on the case, the complexity of a case, we cannot call every person every day, no matter how hard we try. So we have to prioritize the people who are elderly, who have significant medical problem. So we sort of flag them, we call it, and then make sure our nurses are contacting them. Who are living alone, who may not have support, those are our higher priority to call. The other thing which we encourage people, especially for those who are in quarantine, is to enroll in a texting program of the New York State, which has been there for several weeks now. We started to enroll them, and we are going to have people enroll for the temperature monitoring, which is good. This has been tested by New York State. It has been enrolled throughout the New York State, and we have few people in there. But this way, what happens that we get alert if that person has fever. So it makes it, technology actually saves quite a bit of time and efficiency. The other reminder for the non-household contacts, the same things apply for the 14 days, as I mentioned. And the last but not the least is returning travelers who are coming from, still from different countries. They are going to still in what we call precautionary quarantine. for 14 days. So these are the things, if we continue to monitor our community, I think we can get where we want. We cannot let our guards down. That is a very important part, which I would like to, especially to those who are getting off either isolation or quarantine. That's my biggest ask of everybody. Thank you.
Thank you, Doctor. And to touch on social distancing, this is tough. And there are some metrics now that are being utilized via technology and via cell phone activity. And it's amazing if you spend time doing this. They've analyzed each county and how each county is doing with social distancing. Then they grade it based off of your percentage, based off of data. So we got a B. And we basically cut our density by 35%. But recently that went down to 33%. So we need to step it up, because if we want to flatten this curve and we want to go the other way, we got to do better. And that's why we have made the policies that we've made. And I'm going to tell you a funny story real quick. It's usually I save the funny stories for the end, but this has to do with social distancing. I got a very nice email, believe it or not. I know people don't understand that I get nice emails, but from Ian, West Genesee High School. Ian, if you don't want me to talk about the school, don't send me the email at the high school. But certainly Ian has a potty mouth, and he was very mad that we stopped extracurricular activities for spring sports. And I get it, and it's tough. But the reality is, these are the things we need to do to keep people safe so we can get back to normal. And Ian, I promise, next year, I know the sports you play, I'm going to come to one of your games. But you do need your mouth washed out with soap. So after that, it's important that we take this seriously, because we got to get there. People, our disease control experts use algorithms based off of how much we social distance, and then they predict models. And for us to get on a model to get to the point where we can start to talk about economic recovery, we got to do better. We need to do better. We're doing better as a community, and I thank everybody for that, but we got to even step it up more. Access to assistance, our upstate triage hotline. If you don't have health insurance or you can't get through to your primary care provider, you're symptomatic, you want to get screened for a potential testing, the phone number is 315-464-3979. Our seniors, healthcare worker, and adult nutrition hotline, very busy. I want to thank all our volunteers who are helping do this for us. 315-218-1987. Child Care Solutions, one of our great partners for daycare. There's also different practitioners in daycare. People emailed me, wanting to make sure that there's different networks available that are still open. So I wanted to give you a shout out as well. But our partners at Child Care Solutions, if you run into a daycare challenge, you're an essential business, our healthcare workers, our emergency management workers, we have slots for you. 315-446-1220. Donations of PPE, we've talked about this, our protective gear for our first responders, 315-435-2525. And certainly people who are having a hard time with this process, they need a valve, they need someone to talk to. 211, we have mental health professionals that are certainly there willing to work with you with that. Before I go into questions, I just want to thank everybody related to the donations. Obviously, yesterday was a big day. We got to talk a lot about toilet paper and all the donations related to toilet paper, which was good. Certainly, we've had many volunteers helping people with groceries, pick up prescriptions, deliver meals. I want to give a big shout out to County Legislator Deb Cody, who's been out there almost every day with us. Thanks, Deb. And I want to thank Wegmans and Green Hills for their donations of bags and boxes so we can deliver the food to people. But saying that, we'll take some questions. No questions, huh? That's the quickest one yet.
Ryan, how many health department investigators are there now, and are some of those medical volunteers who have come back to work with the health department?
We have over 40 investigators, and we had a network of 300 volunteers, and we've had multiple, out of those volunteers, Tim, a lot of them are doctors, and doctors will be volunteering their time. We will sign a volunteer agreement with these doctors so they can help out Dr. Gupta, and they are fantastic. They are then helping complement and supplement where the gaps are within the department overall. We're very happy with the volunteers we've had to date with our health department for health department investigations and quarantines.
Also, there was I guess, a confirmed positive test from somebody who had been at Iroquois Nursing Home. Do you know of any other nursing homes that have been affected? And do you know if there are any additional precautions beyond what all the nursing homes are already doing to limit visits?
Yeah, I don't think they're allowed visitors, right? Unless there's a pretty eminent, yeah. So I think, look, we've seen in other states what has happened related to that. Our health department is taking this very seriously. We're giving the guidance on nursing homes is evolving and changing, just like everything else. But certainly we want them to be as conservative as possible. We're getting a lot of our PPE to our nursing home professionals each day as they need it if their supply chains are out. But certainly we're in close contact with many nursing homes. I've not heard of any additional cases related to that. Again, the health department, there is a wall up between personal information between my office and the health department. And when I get brought in on things, or when there's gaps in investigations, I get certain demographic information, just like you, I share with all of you. And then if there's a trend or a issue, I get brought in. I'm going to make an assumption right now that there is no trend at the Iroquois Nursing Home, or else Dr. Gupta would grab me right now and tell me I'm wrong.
Ryan, at some point when this is all said and done, we will have known someone personally that tested positive. We will have been in places where somebody tested positive. So we have to take these with a grain of salt, and every time an employer announces they have someone sick, we need to, put the brakes on that. That being said, Wegmans confirmed one of its employees in DeWitt tested positive for COVID-19.
Mm-hmm.
Is the contact investigation by the county health department complete, and did any exposure happen to customers?
I would say that if there was a gap in the investigation, Andrew, we would put out a press release saying at this location, at this time, we have a gap in our investigation, please contact us. We have not put out that press release, so there is no gap in the investigation. And again, this is where we talk about it, right? This is where it gets uncomfortable, and we get it. Trust me, I get it. But how does this spread? Saliva, coughing, sneezing, in direct contact with somebody, and that's how it spreads. It's not a guarantee, right? But that's how it happens. So you would really need to be in direct contact with that person if you were shopping for that to happen, right? So if there's not a press release, the public can rest assured we're comfortable that we have the individuals that should be in a quarantine.
We don't know what this person does, what their role is at Wegmans, but generally speaking, could the health department, and maybe Dr. Gupta wants to weigh in on this, can the health department reach out to a company and get a log of customers that went through a certain aisle, or in other industries, a log of customers, basically databases of information of who needs to be contacted?
Yeah, so if Dr. Gupta wants to chime in, she can here. But again, through our investigation, we're going to know, for most cases, your direct contacts would be other employees. So then you would look at the other employees that you had. If there was a concern via video, right, that this individual may have had direct contact with someone in aisle so on, you then would probably be at the point where we would need to ask the public for help because there's no way to, hopefully they don't have AI at this point and figure out how to do that. But I think that's kind of, it's uncomfortable. We know a lot of people go there. We know a lot of people work at these employers now that are putting things out. but at the same time, there's no 100% risk mitigation, or else this thing wouldn't be what it is today. But our health department's investigation is as complete as it can be, unless you hear from us. Want to add anything?
The only thing I can tell you is that I think a lot of anxiety comes because when you think of measles, when you think of TB or mumps, so measles, you can have the virus stay like, for 2 hours or so. So we become more conscious of that, and then we actually reach out in a more active way to find out who could be the customers and how can we do outreach. In those situations even, we still have to do press release. TB is a little different. The interaction, was it at pharmacy? Was it at grocery somewhere? So in those situations, we can go and try to do that. In COVID-19, it's a little different. It will be like flu in a way. So very direct exposure is the one which we look for. And our department goes through the employer, the supervisor. They get all the information based on the information which the case has provided and supervisor has provided. We can confirm if the person didn't work when they were sick, there is no reason. And I know this is, and employers are doing in due diligence, which is fantastic because it's raising awareness, but it should not raise alarm. So there is a difference between information and alarm. And that's what we are asking people to, not to get alarmed, just take this information because it's a community spread. It is going to happen. We will know, as you were alluding before, that it is going to happen where we go. So how do we take that information into our context and feel comfortable about that?
So there's a good chance an employer puts out this information to their staff, but that person has been staying home due to the symptoms for days.
Right, so we have recommended at times that we said we don't need to put the press release out. If you feel that it's your duty, because people talk to each other and then it becomes a very uncomfortable for the employer. This is up to you. If you want to just do a general information, we can help you support, put the language and everything, but we don't feel that we need to put out and put a press release because we did not identify a risk to the general public.
Doctor, can you just confirm, have you completed an investigation of the Wegmans-DeWitt case, or is that underway? Or?
So I'm not going to comment on very particular case at this point. If it did not come out in our public information, that is something we want to protect everyone and not to start being suspicious of any activity.
And have you gone to the extent of using video in previous cases to identify contacts? You mentioned that as a possibility. Has that happened yet?
If it's needed, yes, we will. I mean, they have security cameras and all. Actually, it has been done. State did at one time in one of the travelers. They were able to identify from the security cameras and was able to get the information and confirm. Yes, technology is always very helpful. So if it's indicated, we certainly will use it.
Yeah, I think overall, too, on this, people need to remember Dr. Gupta and her team are public health experts. They're your public health watchdogs. Dr. Gupta does not work for me at my pleasure. Okay, Dr. Gupta gets recommended by me to the county legislature. She then gets a 6-year contract. And so she's not like other employees like Justin. If Justin makes me mad, that's tough for Justin, okay? Dr. Gupta is here working out for the public and not for any of these employers. So if there's a deemed threat to the public, Dr. Gupta and their team act, and that's when you get the press releases. If not, if you don't hear from us, we feel comfortable with our investigation. And secondly, the employers, you can imagine with your own employer, and some of it's happened to some of your employers, where somebody comes back, they were somewhere, a COVID-19 case is positive. Through the anxiety, the employer wants to get out in front of it, talking to their employees, and that's understandable, and that's going to happen. But again, it's when people are symptom, it's who they had direct contact with. If you aren't hearing any more from us, that means we're comfortable, and Dr. Gupta works for the public, not for any company.
Not to beat a dead horse.
Sounds like you're about to, though.
But, well, I believe Wegmans is not confirming that there was this case. So are you confirming that?
Wegmans is confirming.
So
to News Channel 9.
Okay. That answered it. Wegmans confirmed the case. So the dead horse, the horse is not dead yet, right? Yeah, is that
Is
how it
this the
worked
same
out?
situation for the Taft Road postal employee kind of thing? The same thing that you would let people know?
Any case where there's gaps, we're going to let you know. And we've done it on 3 different occasions. And some of the, some are very specific. Some of them where we're telling you what time church was. Some of them are a small business. Some of them are a larger business where we asked for input from the public. So we're going to do that. And this is all about the public health. Dr. Gupta doesn't work for a hospital, doesn't work for a practice. She works for you. I work for you. We want to give you all the information that we can, at the same time, not breaking any oaths to people who are sick.
Can you talk a little bit about April break being canceled for schools? I know a lot of parents have called in worried and upset. Could you just say your thoughts on that?
Yeah, well, I think, I think the issue, my wife being an educator, is that usually that's, if you're a teacher or working in a district, that's usually a week where you get time to kind of charge the battery. So I'm sympathetic to that. At the same time, we're in uncharted waters. How each district and their continuity of learning is probably at different levels. So how active in the last few weeks were people or whatnot, I think that's kind of what state ed was looking at. So certainly from a spring break standpoint, on April 4th, I was supposed to go somewhere. That is canceled. Everyone else should cancel their spring break and stay home. So I'm not sympathetic for families that don't get to go on vacation because you're safest at home. I am sympathetic that this is a week that usually our education professionals are getting a chance to recharge their battery, which certainly, I know some of them will miss it.
And can you talk about the federal dollars being allocated to Onondaga County and if you think it's enough and what you're going to use it for?
Yeah. So I'll say this. I have some data. That's some interesting data. We have more cases in Onondaga County than Guam, Wyoming, South Dakota, North Dakota, West Virginia, Nebraska, Hawaii, Puerto Rico, and Montana. We are essentially in a statistical tie with the states of Delaware, New Mexico, and hopefully we don't catch them, but slightly ahead of us are the states of Maine and New Hampshire. At some point, and I know there's another package being discussed right now in Washington related to states and local governments. At some point, there needs to be an acknowledgement. I think a lot of these packages have done very good things for residents and with unemployment, with stimulus checks, with small businesses for capital. Certainly, we're very happy about the initial package where if the governor accepts it, the county will get more FMAP money. But I think in this next package, there needs to be an acknowledgement that some of us are impacted more than others. And our county is 467,000 people. We don't meet that 500,000 criteria that is there for a lot of funding. We're really servicing all of central and northern New York right now. So I would love to see an accurate reflection of aid to us in this next package because we're getting hit hard, we're spending a lot of money. We have a lot of responsibility. All of you have been asking me about what happens if you run out of equipment, ventilators, ICU beds. That's going to cost money. We're preparing for that. We're going to spend that money before we have to so that we are prepared. But certainly we believe we have a very strong case for more federal aid and state aid.
Is the county in line for anything from the first package?
In the first package, if the state takes the Medicaid money, we would get $20 million of federal FMAP money for Medicaid. So essentially what would happen is we would pay the state $20 million less in each week over the course of 52 weeks. So that's real money, Tim, when we're talking about in 2 weeks from now, you're going to want to talk about what's the economic situation. That's real money for us. It's a big deal. Senator Schumer, John Cacco, Congressman Cacco did a great job for us with that. The state needs to take it so that we can receive it. But the that's not going to solve our problem. Our problem is much greater than $20 million.
I have a question for Dr. Gupta. I'm sure you've seen the reports that pink eye is now being considered a symptom for COVID-19. I was just wondering your thoughts on that, whether or not you agree or if you've seen that in patients that you've been dealing with.
Can you repeat the question? I missed that beginning.
Some reports have been shown that pink eye is now a symptom for COVID-19. I was wondering if you've seen that in patients that you've dealt with or if you agree with it. Have you been seeing those reports?
So we have not seen as currently in our cases yet, but certainly we'll keep an eye on it. Some of these are very non-specific symptoms. The virus can impact many things. Nausea, vomiting, diarrhea was not even considered first, right? It was cough and shortness of breath and body ache. All these things have changed now. They have increased. The headache is one of those very prominent symptoms, as well as loss of sense and taste has become very important symptoms. As it continues to evolve, we will continue to learn more about more specific symptoms, and we never take anything for granted. Listening to patient is the most important part of that, because they can have different sorts of presentation, and we are there to listen and put two and two together.
Ryan, of the 31 people in the hospital, are those cases evenly distributed among the 3 hospitals in Syracuse, and is it up to the patient where they go, or is there a plan now that the number's that high?
Yeah, it's up to the patient. Right now, there's capacity in each hospital. So one of the things that we've been doing is we've continued to have discussions with our hospital executives and their infectious disease teams about making sure where we are each day with beds, having a plan. We think, we think, this hasn't been confirmed, but that when the governor's talking about needing more capacity outside of downstate, upstate means different things to different people. When we say upstate, we think of ourselves, right, as Central New Yorkers. Upstate, if you're in New York City, means like Westchester County, the Hudson Valley. So we think what may end up happening as there's a surge in need is that the surge may go from one region to the next region's surge goes to the next, and whatnot. So we are preparing to meet the needs of all Northern New York and Central New York through this process. Why are we doing that? Because we already do meet the needs of Central New York and Northern New York with Upstate and Crouse and St. Joe's. Many people who go to the doctor every day to those facilities don't live in Onondaga County. They live in other counties. So our number one priority is Onondaga County residents, making sure that everybody has the medical institutions that they're grown and accustomed to, then Central New York and Northern New York, and if there's capacity after that, certainly we might need to help out the Capital District because they had people come into their district. So these are all things that we go through every day.
Do all 3 of the big hospitals have at least one COVID patient that they're treating?
Oh, I believe so, yeah.
Okay.
Yeah.
The governor also mentioned today that there's a level to this triage system. Even before he would move patients upstate, he would borrow upstate New York doctors downstate in hospitals in New York City. Are you aware of a plan to use any Central New York doctors in New York City?
Look, I think you're going to get to a point where there's a need for medical professionals in the hot zones, and they're going to look for medical professionals to volunteer to go to those hot zones no matter where they come from. I saw a really nice photo of an airplane full of medical professionals. I'm not sure what state they were coming in, but going to New York City. That's fantastic. I think a good strategy, and I'm sure they're implementing it, is to look at other states right now that are not under the same type of stress that New York is, and then certainly look at other parts and regions of the state. I think at some point you might see international doctors who have gone through this, and it's no longer an issue, whether it's from South Korea or other parts of the world, coming in to help treat, right? This is a huge, huge challenge for the state, the country, and you got to do it in a plan, in a coordinated way, and I think they are, where the do no harm is implemented for all parts of the state. And so we can't take too much from one section of the state and then create a problem somewhere else that wasn't there before.
He said this today, though, that he would borrow doctors, and we'll make that request today. I don't know what that request looks like, but are you aware of any Syracuse area doctors on standby to go to New York City?
At this point, Andrew, I have not been told of any doctors. I think that doesn't mean I won't get back to the office and say there was a conference call and they just made the request. Certainly, we have more cases than 10 other states. I think we have a pretty serious situation here right now. I'd like to keep our doctors here. If there's other ways we can pitch in, let's figure that out. But certainly, the medical infrastructure we have here services over 1 million people. In 2 weeks from now, we're hoping we're flattening a curve, but it certainly could go the other way in 2 weeks from now, and we'll need all those doctors. So this is good. This is fluid. It's a fluid situation.
You're talking about medical infrastructure. A lot of the tests right now going to Quest, going to Wadsworth, far away.
Yeah.
Is there any talk about getting those tests done here at Upstate in laboratory lines? I know we talked about it before.
Yeah. I talked to Upstate about this. I think maybe over a day ago. But they got to work with the right manufacturer to get all their systems in place. I think they're still working towards that, and hopefully we'll be able to do that. Also, you probably saw yesterday this Abbott testing that actually part of Abbott, which was I think the president was showcasing this test. Part of the parts of that are actually made at Tessie Plastics, little FYI. But that testing is supposed to happen in 15 minutes or so. Understanding if with our medical team, if that's a good solution as well. Certainly, if we could get our hands on something like that, and it was reasonably priced, that presents lots of different opportunities on how to really take this fight to COVID-19. But certainly we wish there was a lab in Syracuse that was turning it around in hours, not days.
You mentioned, I think 485 test results are pending.
Yep.
Which seems like a larger number than before. Are you seeing an uptick in tests?
Yeah, a little bit. We saw, I mean, we were trending, Tim, I think at our triage site for, over the last, on average, about 100 a day. Some days it was like 75 on the high side, 125. I think yesterday did with like 130 at the triage site. So I think you had a little bit of a little uptick with that. Certainly not anything like we had at the start of this process with testing when we had 400 and 350 and 300. It's on average, 7-day average, you're looking at probably at the triage site 100 tests a day, and then you build in Kraus and Joe's and Upstate. So we've been probably running about 175 tests a day in the community.
And there's a slow but steady increase in the percentage that are testing
Yeah.
positive. Should we read anything into that?
I think it's too early to tell, but I think the suggestions that I would put forward is that people initially, probably a lot of people are getting tested that just were sick with something else. Now you know more about what the virus does, and the doctors understand it better, and you're identifying it better. I think probably the fact is that the respiratory illness hopefully is starting to level off a little bit. So what's left is really more related to COVID-19. And I think on your contacts have gone up a little bit. I mean, if you're getting tested in a household with somebody who has it, that's going to lead to your percentages too. But
of the newer cases coming in, being confirmed, is there a trend? Do we know, are these people that failed at social distancing early on? Is it that they're essential workers and still around a lot of people? Is there a trend as to where positive cases are still coming from?
I'd be interested in your second question. I don't know the answer, or the essential workers, to really look at that, because I think it goes to the point, if you're sick, why are you going to work, right? So that's something that we'll see if we can squeeze out of our health department to look at for us. But I think if you look at the increases each day in the demographics, we've seen more cases in the 20s goes up every day, right? That's at 53. That's our highest demographic. The 50s, cases in the 50s has gone up pretty steadily. It's our second best. At one point, we had a big jump in people in their 80s. We had one person in their 80s for a while. Now we got 9. So I think, I don't know what that tells yet, really, that story, except that it's here. And the way that we get in front of this is, if we can do a good job and we get everybody who's symptomatic getting a test, and we can get everybody quarantined, and we do this in a way where we start to flip it, right? People are recovering faster than they're getting sick. What do you do then to keep that momentum? It has to be, we stay away from each other. That's the only thing we know that works right now. We have to starve it. And so I'm pleading with the community to continue down the path we've gone on. We've gotten better. We've gotten more comfortable. But we still need to get better than a B. We got to get a B+. Then we got to go for an A, because that's how we starve this thing out, and that's how we minimize the pain, which is going to be a stark reality when we start talking about the economic pain and the economic damage from this virus.
So I think one thing.
Doctor?
Yeah, to your second question, yes, we are seeing that those people who have been in close contact, we are seeing those are the one who are turning into the cases. So yes, to your second question, that social distancing really does impact, because those people who are not doing it, that's what we started to see more and more cases. And that's why the message continues to flow out that social distancing really should be, you know, the principle for life, and this should be theme for everybody right now. What we continuously see that when we have a one case and we have a many contacts, they congregated, they got together, despite of all this has been happening. So I think when county executive comes and does press conference every day, I'm here every day with him, a lot of those things are just reminding people it is here, there is a community transmission, it's not over there, and people really need to take it seriously.
So there's a noticeable chunk of new cases of people who failed to social distance early on.
That's what has been happening when there are cases. Most of them are coming because they were somewhere in the vicinity get together. Some of them are still, we don't know how they were exposed, that's true. But in general, we are seeing that there was a relationship.
You heard it from Dr. Gupta. I mean, we're saying it every day till we're blue in the face, but that's what's happening. And
Has there been any specific party or hotspot or that you've traced cases to?
So these are small,
yeah.
these are mostly small house gatherings, different thing. 10 people get together, they got off work. Those kind of things, mostly, they are very non-specific things. So, you know, when we say that do not have big congregation at your home, that doesn't have to be in church. You can do a lot of things in your own home, and doesn't have to have a big party in some big hall. If people are going to continue to do that, one person who might have been exposed to somebody in that symptomatic period can result into impacting so many of them. So the repeat request of social distancing and do not do that, at least for next several weeks, is the plea of county executive and myself, is that please do follow what we are saying, what data is telling us in our own community.
Ryan, a lot of companies have laid off workers because of what's going on. Has the county had to have any layoffs or furloughs?
Tim, we have a line of workers with what are called our 103 work line, and these are individuals that are typically seasonal or are brought on to plug a hole. We had to essentially next pay period cut off our 103 line by 50%. And
How many people?
I'd have to get you numbers, but these are part-time workers that we can get you some numbers, but the reality is that we are no different from any other business. We have no clue what our revenue is going to look like in 3 or 4 weeks. We are going through austerity measures within our budget already, and are implementing things, and that's going to be painful. Now, this 103 line, this may be mostly part-time work for people. Some of them may qualify for unemployment, but certainly we're going to do everything we can to keep our workforce at full staffing levels, but we're just like anybody else. There's no money. How do you do it? And so that's why when you talk about this impact and the reality it has on us, one of the largest employers in the county, it's got a big impact. And we're the government. This is a little different because we have to look out for the public health. So we have to balance that. We balance the public health over everything else, but at the same time, we're shooting ourselves in the foot on the revenue side. And we do that now, but we need a recognition from our partners who can print money that we might need some help. Any other questions?
I have one more question, Ryan.
Andrew, what might that be?
What's the good news?
I'm going to tell you a little story. It is Women's History Month today, month of March. I'm going to tell you a story about a little girl. She was 12 years old. After Title IX, she was one of the 2 individuals in our county to be the first little girl on a Little League team. And she was better than all the boys, and she made the all-star team. And fast forward, I'm not going to say how many years later, but she happens to be my deputy county executive, Ann Rooney, who is one of the frontline generals in our fight against COVID-19. So the good news is that Onondaga County has Ann Rooney on that line fighting COVID-19. Thanks, Andrew.